So I've just no disclosures. Everything I talk about here is really my own personal opinion. And it may not necessarily reflect the opinions of program directors across the country. They may have a completely different experience from what I talked about today. So I wanted to highlight Dr. Raghavendran. He has really been a model, both for the resiliency and his ability to come from an international medical school and succeed so tremendously throughout his entire career. He did medical school in India and came to the United States as a resident. He completed a prelim year and then his residency at Bronx Lebanon Hospital. He's been at the University of Michigan for many years. He's a professor of surgery, has 182 publications. This slide is old, so I'm sure he has many more since then, and has really been an outstanding mentor, educator, and clinician throughout his entire career. So I kind of talked about this a little bit. The differences between IMGs and U.S. medical graduates applications can be a little bit challenging. One of the first things we need to figure out is the work status. Most international medical graduates have to include whether they are approved to work in the United States as a resident. I'll talk a little bit about that in a second. The standardization of the medical school curriculum, which we discussed just now. Clinical work experience can be really challenging in other, when you look at international medical graduates' experience in medical school. I think most program directors understand that clinical experience happens during the clerkship and sub-I rotations, whereas many international medical graduate schools don't necessarily have that same structure there. Many international medical graduates do research as an attempt as a gateway into the U.S. medical system, and program directors often wonder, does this research actually matter when it comes to clinical performance as a resident? Many international medical graduates have also taken time away from their clinical duties. They finished medical school, they've done a couple of years of research in a U.S. medical institution, trying to get their foot into the door for U.S. surgical training. So this is what the initial page looks like on the U.S. application. And this authorization to work in the United States is something that program directors need to closely look at to make sure that if you accept this applicant into your residency program, they're going to be able to complete the entire clinical training, which is the 5-year visa status. This is a complicated thing, and there's so many different types of visas that are available, and program directors have kind of ad hoc figured out a way to interpret these to make sure that if you do hire the resident, that they'll be able to stay the entire 5 years. But you can see there's multiple different options there. Just trying to figure out which one will allow them to complete their training. So would you like me to go over this, like an example of a application?
Yeah, I think that would be super helpful.
Okay. So this is a purely made up example of an international medical graduate application that we have reviewed in the past. Remember, most residency programs get about 12 to 1,400 applications, typically for anywhere from 5 to about 10 residency spots. There are a lot of applications that we have to go through. So this international medical graduate did 7 years of medical school outside the U.S. They completed their medical school and now are doing 2 years of research at a large U.S. academic medical center. They've been great. They've been very productive in their research, got 42 published works, 11 of them as first author. This is many more than many U.S. medical graduates have by the time they've completed 3.5 years of medical school. But they've had no clinical experience at all since medical school. They may be working at a big institution doing research, but they've been away from patient care for several years. The letters of recommendation they have, 3 of the 4 come from research mentors at the U.S. institution that they're doing research, and 1 was from a surgeon who they worked with 3 years ago during medical school. They have no other clinical letters in their application. You look at the dean's letter, 7 years. They got all kinds of different cases from music appreciation. They even did an internship in general surgery during medical school. I presume that's probably like a sub-I experience, but again, that's really hard to tell based on where they did medical school. Their dean's letter has some letter grades. A few of them have GPAs scored up to 5 instead of 4. And all the evaluation comments in their entire application comes down to one single line in the letter of recommendation from that surgeon they worked with 3 years ago. These are some of the course grades they had. Looks like they do the same kind of clerkship rotations that U.S. medical grads do: medicine, pediatrics, anesthesia, surgery. They got some grades which seem like they're on a 5-point scale, but I couldn't really tell from the dean's letter. But zero comments from any of the rotations about their overall clinical performance in the dean's letter. So it's based on the dean letter, it's a completely black box as to whether this medical student is ready really for clinical care as a surgical resident. Here's a letter of recommendation from a chief of vascular surgery that I worked with 3 years ago. Sounds like they had a great experience. They did, almost 200 different vascular cases over the month. And the one comment the surgeon makes about this student is that the surgical skills are still in progress of refinement, but that they've shown keen abilities regarding the basics of surgery, bedside manner, and the care of patients after surgery. In the entire 50-page ERAS application, there's one line about their clinical performance. And as a program director, that would give me a lot of pause about whether this student is actually ready for surgical residency. So this kind of highlights just some of the unknowns for IMG applications when program directors are reviewing them. And the biggest area that I think program directors wonder about is what is the overall clinical training quality that the student has at their international medical school. It varies so widely. I think most program directors understand the U.S. medical system and what kind of clinical training the student gets during resident or during medical school, but the international medical student exposure is somewhat unknown. Ultimately, we want to know how they're going to function in a U.S. hospital system. Are they going to be a good resident? Are they going to make good clinical decisions? Are they going to be able to communicate with other members of the team? Are they going to be able to become leaders on the service when they become chief residents? All these things are the most important things that program directors look at when it comes to matching people into their program. Interpreting the varied medical school curriculum is really hard for program directors. And the other question we have is surgical research really meaningful for surgical residency. Many programs throughout the country have 5 years of clinical training with maybe an optional 1 or 2 years of research. Success in research doesn't always translate to being a successful clinician. Understanding the work authorization status is difficult. There are some courses available for new program directors to help figure this out, but it seems like the government changes some of the rules every year and start to keep track of all the new rules. And what we want to do is make sure that we can provide the complete clinical training for an international medical graduate, and that the visa status is not going to get in their way to be successful for that. Letters of recommendation can be hard to interpret. And ultimately, when you look at the entire ERAS application, we want to know, is this applicant going to be a good resident? And we need information in the ERAS application to help us figure that out. And with international medical graduate applications, there's a lot of empty spots in there in the application to make it hard to kind of interpret. So when we think about what IMGs might be able to do to improve their overall ERS application, is really trying to demonstrate the quality of your clinical training. How did your medical school, how did the experience either in a US medical system or in an international medical system prepare you to be a surgical resident clinically? Make sure that comes through in your personal statement, in at least 2 of your letters of recommendation where they can talk about your clinical care, and really try to get the dean's letter to populate with some comments about your overall clinical performance. If it's possible to get experience in a U.S. medical system, actually working as some sort of clinician, either volunteer basis or a paid basis, that would be very helpful. That would prove that you've developed the skills in medical school to make you a successful surgery resident. Explain how your experience in the U.S. system has helped prepare you for residence above and beyond just the research that you've done in the U.S. institution. Talked about the dean's letter, the MSPE, make sure there's some evaluation comments about your clinical performance. Many international medical grads have had a long distance traveled. They are very resilient. They have been able to overcome a lot of barriers to get into medical school in the first place, to graduate medical school, and to be ready for residency. Make sure that distance traveled and that resilience and grit comes out in your personal statement, and maybe even some of your letters of recommendation you have from some surgeons you've worked with. And then, like I talked about, the letter recommendation, make sure they talk about both your clinical and your academic excellence, not just the research that you've done. And if you can at all kind of like portray how you're going to be an excellent surgical resident in a U.S. system, that's what the program directors really want to know.
Yep.
So the take-home points, program directors, I think we're kind of risk averse. We want as much information about a candidate as possible. And if the ERAS application doesn't include that information, it makes us kind of pause about inviting that particular applicant for an interview because there's just too many unknowns. The additional GME requirements and the confirming you're going to be able to complete your residency with the visa you have is important. And most U.S. medical graduates are easily comparable because the U.S. applications look really similar between U.S. medical grads. If international medical grads can make your application look just like a U.S. medical grad, it allows us to compare those a little bit more easily. And we all know that there's tons of superstar international medical graduates out there. Program directors want to find these. We want to bring you into our program, but the question is, how do we really go about finding them? So when I think about future directions, visa reform, I think is really important for medical professionals. Reform, I think, would require a functional national government to make some changes to the visas, and maybe they could create some visa pathways specifically for medical professionals. Some overall increased education of program directors and other people about international medical education, I think, is important. And if the U.S. medical institutions could create some way to allow international medical grads to do some clinical rotations at the hospitals would be really helpful. It would help prove that the applicant is going to be successful in a U.S. medical system, which would maybe help reduce some of the barriers to IMG recruitment and retention throughout the U.S. residency programs. So these are just kind of my thoughts based on some experience looking at international medical student applications. I'd be happy to discuss more and if you have any questions.